Can start recording and Simon can introduce.
Hello, everyone. I warmly welcome all of you on IASNM MISI webinar series. So this is going to be a 45-minute session followed by 15 minutes of Q&A. And just a few housekeeping things to keep in mind before we start is keep your phones and devices on the mute mode. And meanwhile, you can put your questions in the chat box, and at the end of the session, we'll take questions. Now, it's my absolute pleasure and honor to introduce Dr. Sikandar Shaikh, who is a distinguished figure in the field of radiology and renowned for his multifaceted contributions across various international platforms. And he has served in prominent leadership roles and has been instrumental in shaping the landscape of radiologic sciences. He's currently the consultant PET-CT and Radiology Associate Professor at Shadan Medical College, Hyderabad. He's Adjunct Professor, Department of Biomedical Engineering in Hyderabad, Adjunct Faculty, Kasturba Medical, Manipal, and Naipur, Hyderabad. Without further ado, Dr. Shaikh.
Thank you, Dr. Saima, for kind introduction. And thank you, Amol sir and Dr. Jyotsna ma'am and Dr. Ruchi and entire team for giving me this opportunity. So I apologize, first of all, because we are a little late because of some technical issue from my side. So with this, without wasting time, I'll just start. And I will switch off my camera because probably the internet is a little slower. So I'll switch off my video. And yeah. So now moving on. Next. Next. So coming to the topic today, the topic is nanoimaging. So we know what nanoimaging is something which has come all the way long. So there are certain things which we should know before knowing. So it is a part of a molecular imaging. So we all know there are a big list of molecular imaging modalities, and so many are getting added, and there are a lot of stuff which is happening in relation with this newer technique. So you have ultrasound, you have MR, you have optical imaging, SPECT-CT, PET-CT, and PET-MR. They are mostly available right now. Probes and imaging of molecular interaction, nanoimaging, and genetic imaging. Sorry, the spelling is wrong. But now our current topic is nanoimaging. So we all know what is nanoimaging. Because my topic today is something I will be talking in relation with the basics. What exactly is a nanoimaging? What is a nanotechnology? What are the different applications of the nanoimaging and the future of nanoimaging? What is going to happen? So we all know the nanotechnology. It is some sort of a technology, because I know a lot of audience, they are not aware. They heard about nanotechnology, but they don't know what exactly it is. So it is something related with the dimensions between 1 and 100 nanometers, or between 1 and 100 billions of a meter. So it is very, very micro level. So it is very small. But you might be wondering how it is possible. So they are capable of different manipulations which can modify the various atoms or molecules to create the nanoparticles. And nanoparticles, they are similar to that of molecules and cells that are affected by various disease processes. And this manipulation, and they are adjusted for various functions. Next. So something very brief, it should not be some sort of a out of way, but where the nanotechnology started. It was somewhere in the California Institute of Technology on December 29th. There was one topic and one session which was happening on plenty of room at the bottom, an invitation to enter a new field of physics. And this was by the Richard Feynman, who is credited for the development of nanotechnology. And it was further carried by 1970 by Eric Drexler, and 1986 the term coined was nanotechnology in his books by Engines of Creation. And again in 1992, Drexler did major work and has published on nanosystems, in which he showed the study of a high-performance machines into molecular carbon lattices. Next, please. So nanosystems. So nanosystems is first nanotechnology textbook in the world where the literature is there, and the synthesis of Something like fullerene or buckyball was mentioned in this 1985, and this was led to the important synthetic hollow geodesic sphere made up of 16 carbon atoms, which resulted in the origin of carbon nanotube in 1991. So among all the nanoparticles, carbon nanotube is one of the first to be originated. Next, please. So now it is one of the most developing sciences in the world, and there are different applications. The most of them are still in research stage. They are yet to be identified for various novel objects, easily modified and created in different formats. So most of the stuff is happening at research level. And again, the nanoparticles are based on various properties. So it's not a single thing like you have ultrasound, sound, or MR, magnetism. But here you have optical, you have electrical, you have magnetic, or sometimes non-medical applications are also there. And the important property of nanomaterials is to provide a large surface to the volume ratio, and they are used on different applications. And again, since it is a physical component, the quantum of law of quantum mechanics instead of the classical law of physics and chemistry is used. So again, it is based on the quantum mechanics. So what exactly are the nanoparticles? So they are made up of polymers. They can be proteins, they can be lipids, they can be lipoproteins combination, various metals, silica, carbon nanotubes, various elements like selenium, cadmium, and their role now is for diagnostic as well as theranostic agents. But most of them, they are at a diagnostic level. And again, the theranostic nanomedicine is something which is being very widely coming up in coming years. So where diagnosis as well as therapeutic agents are there. See the range of this 50 to 800, and it is 100 to 600. So it is very, very small, ultra small, small. So the shapes are different. So coming to that, based on shape, there are different nanoparticles. Next, please. So nanoparticle imaging. So it uses the signal intensity. The stability in the biodistribution of the submicron is there. Then the stability, the synthesis, the properties, the applications, they are again based on the shape of the nanoparticle, size of the nanoparticle, properties, whether they are related with the magnetism or physical properties, the surface area, because the larger surface area, again, it is based on the shape, and again, nanoscale size. So what is the size of the nano in the nanoscale? Again, that is also important. Next. So for imaging, we are talking about imaging. So we know how the nanoparticles can be imaged. So this is equally important. You have nanoparticles, but they have to be imaged. So you have X-ray radiography, you have CT, you have MR, ultrasound, PET, SPECT, fluorescence imaging. So many things are there. So shortly, I will be talking about this. What are the different applications by different modalities? Next. So what is a basic biomechanism? So how does this nanoparticle is used for imaging? So nanoimaging agents, even though they are very small, but based on the different shapes, they have very high surface area to volume as compared to the routine contrast agents. And thus they are capable of being labeled on the surface with a specific molecules and ligands, leading to less toxicity. So this is something like they act as a carriers. So we have something nano carriers, which I will be talking in future coming slides. So this is for visualization and monitoring of the biological process. Any pathology is there to identify that pathology, to monitor that pathology post-treatment. Then you have macrophages detection, for example, in atherosclerotic lesions used in the CT nanoimaging, molecular imaging of angiogenesis, longer plasma circulation, better biodistribution, greater lesion to background contrast, shape and size of nanoparticles, again are stable and they are used for various applications. So now, again, the chemistry comes. So particle means we know they are chemical components, they are elements. So what are they? They are mesostructures. They have similar properties of atoms or molecules, and they can be compared in the same way as a semiconductor nanoparticles, which have some magnetic properties. And that is where the role of MR or magnetism is useful for identification of these nanoparticles, and they are used by MRI for identification. And there are three different types of nanoparticles in number. So you have polymer, you have biomacromolecule nanoparticles, then you have semiconductor nanoparticles and metal nanoparticles. So they are different, but ultimately the chemistry defines what exactly are they. Next, please. So if you see this again, already I told gadolinium, you might be wondering, we are using it for MR contrast. SPION, it is related with the magnetism, magnetic MR evaluation. Then you have nanodiamonds, carbon nanotubes, graphene, manganese, silicon peptides, then golds nanoparticles, bismuth, iodine, copper, selenium, quantum dots. So if you see the shape and sizes, so it is a dendrimer. The shape of this is something different. You have SPIO, then you have gold nanoparticles, you have quantum dots, you have polymers, liposomes, microbubbles, beads. So if you see, number one is the size. There is variation in the size. The shape is entirely different. And most important, the surface area. Because if you see, they are very tiny, but the way the amount of the surface area they are having is very big, despite of very small in size. Next. Then again, coming back, nanotechnology, we know a lot of applications. There are a lot of therapeutic agents. It is most important is it should not have any impact in the surrounding healthy tissues. And the delivery of drugs as a nanocarriers is also one of the things which is happening in vivo imaging. Next, please. So if you see this, so again, these are polymers, these are dendrimers, these are liposomes, then polymer micelles, polymeric nanoparticles, inorganic nanoparticles, carbon nanotubes, fermin nanocages. So these are different shapes and different sizes and different surface entities of these different nanoparticles. Next, please. So nanocarriers. So the word carrier itself is something like a nanoparticle which is carried. It is used for diagnosis, therapeutics, molecular targeting, better function, specific targeting of particular tissue or a cell, and drug delivery system. So nanoparticles can carry a drug along with that to a particular target area for proper precise management of that particular disease. Next, please. So again, size, I'm not going to go on that. And we have seen the surface area, target is there. So that I will show you in coming slides. Next, please. So again, the shape we have seen, but here only the important is kinetics. So kinetics is different for all the different nanoparticles. And again, it is based on the cells where you are injecting, whether it is in the GI cells or it is in neurons or it is in the blood vessel cells or it is in cardiac cells. So again, it matters where they are. Next. So this is something, a literature which is showing. So I will describe this in coming slides. Next. Surface. So what is the surface? I already showed the surface area is very important because it carries charge. It has to be soluble. It has to be affinity for the coating materials as a carrier. So nanoparticle should be easily, they should not be chemically, means more where they can cause reactions to the adjacent cells. So they should be benign. And this is very, very important. And they should have binding capacity so that various binding can be done. And again, neutral, negatively charged will also have a longer circulation times. So this is something chemically which we need to understand. Next. Nanogels. So gel is something where we know that they are like some sort of a liquid, or but here hydrogels, they are made up of polymeric particles, hydrophilic, they are related with the water components, they're better biocompatible and good content of water. So gel itself means it is a liquid, so they are related with that. And so they are uniform, they are moldable, they have ability to prepare easily, they are less toxic, stability in the serum, stimulus response, and substantiable release of activated components which can be degraded. But again, everything is dependent on other properties because they can cause deformity, they can swell the cells, they can be loading drugs, they can have a better biodistribution, faster clearance, less toxicity, and release of targeted drugs and nanogels. So these are advantages of nanogels. Next, please. So dendrimers is another. If you see the shape of dendrimer, so this is a dendrimer. So we'll be seeing about Michel and polymeric nanoparticles. So I'm not going in detail, but this is something like today. I just want to show what are the particles. So if you see, they are three-dimensional. They are branching pattern is there, and they can have, because of this branching pattern, they can have different interactions. They can modify, and ultimately they can trap the drug or release the drug at a particular entity. So ultimately, it is having a better targeting. Next, please. So thermoresponsive. Again, thermo means temperature and response. So how you are going nano carrier. So this is more important, especially in a cancer therapies, especially for the solid tumors. We know that thermal means it is temperature related. So temperature has a very important impact on the body as well as on the tumor area. So this has an ability for the limitation of the disease control by limiting the better control of drug release in a phasic manner. So again, the thermoresponsive polymers, they are also an important entity where the nano carriers are being used. Next, please. So pH is something we have seen. We know the pH of water is neutral, it is 7. So what is that pH? What will have an impact? Because any pH, liquid, so it will have different settings, different biochemical compartments, and mostly the nano carriers, because they should have an optimal pH for carrying the drugs, for acting, for their physiological function, for identifying or for drug releases, whatever reason. So pH is very important for nanoparticles. Next. So ultrasound triggered now. Now coming to the ultrasound, I have told about X-rays. X-rays doesn't have much relevance, but ultrasound, CT, MR, there's so many things which are there where nanoparticles are being used to image it. So ultrasound can be triggered. So it is a non-invasive, we know, frequency can be adjusted and it can generate the mechanical forces. So what happens here? It is on the right side, you have an image which shows the sonoporosis. Porosis is poration where you can easily transport that from within the cell to inside the cell or inside the cell to outside the cell. That is where the nanoparticle drug delivery to the particular cell happens here in the upper portion. So without ultrasound, it is difficult. But membrane portion with the ultrasound, it is quite possible. So what happens? The role of ultrasound is an important where they trigger the nano carriers. So the futuristic theranostic application will be for the drug delivery by using ultrasound, not only for diagnosis, but for the therapeutic applications. Next, please. So light responsive, again, we have seen temperature sensitive, now light. Light is also having some sort of impact on that based on the wavelengths of light, and they are capable based on this for the drug release in a deeper tissue penetration. So that is where the role of light can be used. Next, please. So redox. Redox is, we have seen the oxidation process. So this terminology, probably we had read it in our chemistry days when we are learning in our schooling. So probably it is something new terminology. It's not new. So it is a process of oxidative process or oxidation stress in many diseases. So, and this stimulus will respond to the nanocarriers, which are of areas of interest. So there are carriers which are based on this oxidative process. Next, please. Then magnetic targeting. So now role of magnetism is there. So MRI is another entity where the nano imaging can be done or nano carriers can be using for different therapeutic agents. Now I was talking about SPIONS. So what is it? It is super paramagnetic iron oxide nanoparticles. Super paramagnetic. It is very easy. If you see this is something related with the SPIN molecule. So again, this associated with the MR, then added with the elements, it can cause a variation in this. So there are a lot of things which are happening when they are injected in bloodstream. They pass through the magnetic field, and this will result in accumulation of the payloads. And this magnetoporosis is resulting in enhancement of that particular area, which is abnormal, accumulation of the drugs at the area of interest, and penetration of nanocarriers in the solid tumors for the management as a therapeutic option. Next, please. So enzymes. Now, again, enzymes are equally important. We talk about cells. So any cell, we have a biological process where the cellular mechanism is based on the enzymes. So different enzymes will be there. So again, they are used as triggers, and by using the nanocarriers, micelles, liposomes, dendrimers. So these enzymes will be impacting directly on the lipid or lipopeptide or lipopolymer, which is used for stabilizing the nanocarrier. So you need the whatever the nanoparticle also to be stable. And again, ultimately, it will result in an improved drug delivery with the better stimulus. And then nanocarriers are also using ultrasound, light, heat, magnetic forces. They are used for exact target localization. So nanocarriers changes the pH and oxidative stress. So this is an important entity which has to be kept in mind. And with these changes of oxidation and pH, ultimately, it will result in metabolic acidosis or vascular occlusion or other inflammations. So again, we have seen the ultrasound as one modality, but multimodal means it should be different modalities coming together for imaging. So it can be ultrasound CT or ultrasound MR or something like photon imaging or any other thing which is helpful. Next, please. So bio-inspired nano. Bio means something like biological. So what is this? They are biomimetic nanoparticles. Like you have RBCs. So RBCs are there, which has a membrane. And again, they have a lot of actions like in form of near infrared persistence, luminescence, in a form of nanophosphors. So they use nanocarriers for the macrophage uptake and systemic clearance. So macrophage is an important entity for our infection or inflammation, so tracking it and following it. So ultimately, everything is important. Next, please. Gene therapy. Now, genetic imaging, genetic engineering is something which has come a long way, and a lot of things are happening in that along with the nanotechnology. So here, nano carrier. So carrier is the nanoparticles. They are acting as a carrier for genetic therapy. So genetic therapy, what is it? It's for use for some sort of genetic diseases where some sort of interference of interfering RNA to silence the disease. So there you can modify the genetic course of the particular disease entity, and that is where the role of gene therapy comes. Next, please. So now coming to the brain. So brain is also an important. So the applications what are happening is the brain, especially based on this. So why it is very small, surface is large, solubility is very good, drug delivery can be easily done, multifunctionality. So again, drugs to be successfully delivered, we have seen already this size, biocompatibility, target, then avoidance of RES, because once they enter in RES, probably they can be excreted, stability in the blood, because any sort of reaction to the blood will cause issues, and or they themselves can be decomposed or degraded, then controlled drug release at a particular area of interest. Next, please. So ideal nanocarrier, we have seen there are so many components here. I'm not going in detail. It should be non-toxic, biodegradable, biocompatible, stable in the blood. So no other reactions should be because of the nanocarriers. Next. So PA-based multimodal biomedical engineering. So this is something related with the photon energy. So there are multiple imaging nanoprobes which are seen in the biomedical imaging, and they are used to detect sensitivity, better imaging contrast, spatial resolution, and most important applications for this biomedical multimodal is for tumor imaging, lymph node imaging, for metastasis, especially in cancers. Then they are based on multifunctional nanoprobes. So nanoprobes are something which are being used, and by which we know the lymph node involvement in the earliest stages, in the early stage of cancers. Next, please. So ultrasound, we have already seen it, so there is nothing new. Next. So again, we have seen, coming back to the ultrasound. So ultrasound, we know that is what are all the imaging contrasts. So we know microbubbles, but again, these are different elements. So don't get confused. I'm talking too much in chemistry or something like that. But I am just putting forward, these are very commonly available entities and they can be used for nanoparticle as a contrast by using ultrasound. So this is something we know. Nitrogen, we have to see carbon dioxide, liposomes, polymers. So they all are used for these applications. Next, please. So, yeah. So one more important thing is stem cell imaging. I'm coming down. So stem cell imaging, imaging of inflammation, and again, drug delivery to these entities. So there are gases, nanoparticle, nitrogen, air, perfluorocarbon, sulfur, hexafluoride. So these are some of these which are used in stem cell imaging and also for imaging of inflammation and drug delivery to these particular regions and particular entities where they have to be treated. Next, please. Now coming to CT, we have seen ultrasound. CT is something like we talk about, it is how the CT is being used. Now we know it has become one of the high resolution imaging modality, but soft tissue is not comparable to MR. But there are certain things which are coming in a form of nano CT imaging. So nano CT is something applications which where you can detect the cerebral microcirculation. So if you see the image, so it is some sort of a ischemic stroke which is happening. So we know what is happening. It is the brain vasculature which is seen. So what are the entities which is happening? What is the reason of the stroke? So microcirculation is something where no imaging modality can identify today. So that is where the role of nanoimaging, stroke, then lung at alveolar level and trabecular microstructures within the lung, they can be done with the micro CT imaging by use of nano CT. Next, please. So targeted imaging is there. Again, any targeted imaging, you need a contrast. So CT contrast are there and we don't use that. But one of the most important commonly used CT contrast media now is a gold nanoparticle. So that is where the role of metal use in the metal as a use in nano imaging is done. Next, please. So this is something like nanoparticles we have seen. Again, same reason. You have surface, you have circulation, you have different contrast agents and drugs to be aligned with their surfaces. So same components what we have seen in ultrasound. It will be same for CT as well as MR. Next, please. So again, the various sizes. So if just remember this, why I'm showing you there are three sizes, which is less than 50 nanometers is ultra small SPION. Then you have SPION, which is at the size of hundreds of nanometers, and micron is at a micro level. It is not at a nano level. So USPION, SPION, MPIO. So these are three different nano sizes of the nanoparticles which are being used. Next, please. So nanomagnets are something where the used as a para and supermagnetic, and you have T1 and T2 contrast agents and MR spectroscopy. So a lot of stuff is there, a lot of research is going on all these things. Next, please. So SPION we have seen. So it is simple related to the MR contrast, evaluation of tumors. It has a better efficiency and safety. So again, there are so many things which are coming up for the improving the therapeutics of the SPION for diagnosis as well as therapeutics in imaging of cancer. Next, please. So this is one example where you have seen the SPI and super paramagnetic. If you see the image, so on the red, once you are injected in a vessel, so there are tiny iron particles, macrophages, and they are coming at a particular tissue. Then you have afferent lymphatics and efferent lymphatics, and this is a metastatic region here. So that is where the metastatic area, this particle will be lodged and there will be reaction at a particular entity. So this is a normal not a normal, this is a action of that particular nanoparticle when injected to act at a particular level. So that is where the lymphatic system or lymphatic lymph nodes will be effectively suppressed by, and For diagnosis, you can easily diagnose. And for therapeutics, the drug therapy will be reaching at a particular point. Next, please. So again, related with apoptosis. Apoptosis is something very important entity nowadays. So we are labeling it again for apoptosis imaging as a separate entity because of the cancer cells. So the cancer cells are very much sensitive and prone for this apoptosis. So with this, you can easily try to identify that. And there are different components which I'm not going in detail. So they look like very complicated. You have conjugated iron oxide nanoparticle, CLIO. CLIO is something which is used and injected, it will be accumulated and then detected signal by the MR. So you know where is abnormal pathology in a particular area or a tissue. Next, please. So again, these are something like a combination of multimodality. Just remember, a lot of stuff has to come. Only PET-MR is already existing, widely used, but other optical spec with MR is yet to be done. A lot of research is going on. Next, please. Now coming to PET, we know the PET is also a nano imaging, molecular imaging, but here you have radiolabeled nanoparticles. So we all know about detection, characterization, staging, monitoring response. But what is new here? By using radio-labeled nanoparticles. So that is where the use of radio-labeled nanoparticle, this is a nanoparticle in the center. If you see the image, and it can be done for the coating, you see the genetic therapy, you have molecular targeting down, then paramagnetic ions are used, and drug efficiency can be done, because if it is a cancer, then this radio-labeled nanoparticles, when injected, can cause a therapeutic applications also. Next, please. So PET imaging, we all know, I'm not going in detail about this. Next. The coincidence events, again, it is related with the positron emission. So the same principle of PET is there. Only the addition is here, the use of nanoparticles with radioisotope in a nano platform with radio labeling and stability. So it is same as that any nanoparticle has to be stable, whether it is radio labeled or non-radio labeled, which you are using. Next, please. So targeting radio-labeled nanoparticle, I'll just explain this. So if you go by targeting, there are two types of targeting which happens. That is passive targeting and active targeting. Passive targeting is because of permeability of a tumor tissue. So any tumor, there will be more permeability at a particular entity, and that is where the targeting which happens. And active targeting is at a tumor level where the biomarkers can be tagged, and then they can be easily circulated from the blood vessel into the particular area of interest. So if you see on the right side, this is normal as a cell in the lower down, but above is a passive targeting, lower is active targeting. So again, it uses the EPR effect. EPR is enhanced permeability and retention effect. So this is also important phenomena. So again, this is the image of the EPR effect here. Again, it is based on the size, surface, immunogenicity, characteristic, tumor, everything. So this is a tumor, blood supply is there, and there are different mechanisms which are happening at this level. Next, please. So metal nanoparticles are same. You just tag it. There are different entities which are coming. Next, please. So SPECT imaging, again, the SPECT is also an important entity for the imaging of the nanoparticles. So here the gadolinium nanoparticles, 99M technetium, they are using this, and angiogenic regions are there which can be identifying MR molecular nanoprobes. So if you see this nanoparticle surface in the image and that is a core, and you are using the SPECT or PET, then there is some sort of a targeting biomolecule kinker or biomolecule which is happening at this level. So ultimately, the tumor perfusion, tumor extravasation, all dynamics can be easily identified by using these theranostics nanoprobes as well. Next, please. Now, already I have shown, if you see this, there are different types, shapes of nanoparticles now. Sphere, rod, cube, snowflake, flower, thorns, hemisphere. So there are so many. If you see this, these are something rod, these are spheres. So why they are important? Because shape matters. When this is a blood vessel, when they are going in the blood vessel, so the flow and the dynamics, physical dynamics are equally important, because the shape will also identify how fast they can go, how stable they can be. So there are so many important entities related with the shape of the nanoparticles. Next, please. So again, these are we have already seen. So next, please. So optical imaging, we have seen this is something new. Again, a part of molecular imaging. A lot of research is going on. It is again non-ionizing radiation. But nanofluoropores is something which use, and most important is the quantum dots. Next, please. So you have a Raman spectroscopy. So again, the basis of Raman spectroscopy, it is based on the light scattering, which cannot be used for absorption or emission in a fluorescence. So this is where if you see the SERS nanoparticles, so this is a Raman active layer, metallic core is there in the center, coating is there. So there are a lot of phenomena which are happening here. So this is also possible with the use of nanoparticles by using Raman spectroscopy principle. Photoacoustic imaging, that is PAI. So PAI is a newer hybrid biomedical imaging modality. Optical imaging can be used. So this is also part of molecular imaging. Only the thing is addition of the nanoparticles. They are nanorods, cages, or nanoshells. Next, please. So magnetic, we have already seen. Next, please. Nuclear imaging, vector, we have already seen. So only thing is copper, metallic 64 copper can be used. Now coming to gold nano cages and photoacoustic. So this is a gold nano cage which is like used for the tagged with the PSMA radioisotope and used for the PSMA imaging. So like this, there are so many things which can be used and tagged by using the gold nano cages, and the principle of photoacoustic imaging can be used along with the PET or SPECT or whatever the radio labeled entities are there. Next, please. So anti-angiogenesis. Angiogenesis is again related with the cancer, we know. So how to identify that? What is the amount of angiogenesis happening? So these are very important things which is happening and can be identified this by use of nanoimaging. Next, please. So optical, we have already seen. Next, please. Nanobodies, nano cages, nano carriers. So these are all different types of, but here bodies is related with the type of antibodies. So they are again having very low immunity, binding capabilities. Then they are made for cancer therapy, antivenoms, inflammatory conditions, immunoimaging. So these are something which is a new entity which is coming for therapeutic options. So theranostics, we all know it is diagnostic plus therapeutic. So the word theranostic is, and it is coming in a big way, and nuclear medicine or molecular imaging or nanoimaging are very important for this because a lot of research is going on, a lot of things are coming, and ultimately nanoimaging will be one of the most important theranostic entity in coming days. And one of the classical example is thrombolysis, fibrinolysis in a thrombus, so in a cardiovascular event. So gene and drug delivery, we have already seen. Therapeutics means drug treatment also. So delivery of that has to be done. So it can be a drug delivery or it can be gene delivery. So we have seen about the genetic imaging where the gene imaging can be done, but the genetic therapeutic applications is for the delivery of the genetic entities to a particular tissues. Next, please. So arthritis, this is something, one of the important application because nanoimaging is being used, probably this lot of things will be coming in future. So arthritis, inflammatory, it can be, or rheumatoid. So if you see this is a image which shows the rheumatoid arthritis under treatment with nanoparticles. So it is direct injection of the nanoparticles in the arthritic joint, and there will be blood vessels, and ultimately the target cell will be acting, and that is where the role of therapeutic applications of the nanoimaging can be done, and the gold nanoparticles are being used, and different modalities can be used like CTMR, Raman fluoroscopy, and PI imaging can be done with this. Next, please. Liposomes are another important nano. They are also known as nano vehicles. Vehicles means transporters. So they are made up of different compatible layers ultimately, and They have a very important role in the use of the nanoparticles for longer stability. Next, please. Neosomes like liposomes, they are also part of that. They are vesicles and they are also advantage for controlled release of a drug by using the nanoparticles in different scenarios. Next, please. Preclinical imaging. Now, this is something preclinical imaging which is coming in a big way. Preclinical means before clinical applications, so that any research is happening. So it is a part of research here. So a lot of things are happening in that relation with that. So nanotubes, yeah, next please. Carbon nanotubes and nanocarriers in cancer theranostics. So this is something which is being done in the preclinical imaging. So here the use of mechanical electronic properties is also there. So thermal ablation is one of the commonly used in gene and drug delivery. So carbon nanotubes are one of the important nano carriers or nanoparticles which are being used for this drug loading in this theranostics. Next, please. So quantum dots is also one of the important form of a nanoimaging. Next, please. Photothermal therapy. So when you talk about tumor means temperature is also equally important. So the tumor tissue, the temperature, it has to be like for spreading of cancer. So you need a hyperthermia based cancer therapy. So to kill the cells. So hyperthermia will lead to the killing of the cells. So without disturbing the surrounding tissues. So that is where the role of nanoparticle nanoimaging can be done by using different entities. Next, please. That was a photothermal. Now, this is a photodynamic therapy. Dynamic therapy is related when you use the light along with oxygen and photosensitizers. This is another form to destroy the various cancer cells and affinity for the cancer cells. So that is where the role of gold nanoparticles and porphyrins are being used for this photodynamic therapy. Next, please. Chemotherapy, post-chemotherapy, you need to know what is happening in exposition at a tumor level and tumor. So all these nanoparticles, they can be used as a part of regimes of chemotherapy along with the use of nanoparticles for better tagging, better transport, and better carriers. Next, please. So immunotherapy is also one important entity which is coming in a long way. We already know about immunotherapy or but nanoparticle systems here, they are being widely used for delivery of creating robust and better immune responses by stimulating the immune system for better management of the various cancers. So that is where the role of T cell receptors and cancer vaccines or T cells, so many things, cytokines, antibodies. So they are very important in relation with the immunotherapy, and the role of nanoparticle is very important in this. Next, please. So precision medicine, we know that precision medicine is a tailor-made medicine in coming days now. So it has changed a lot. The concept of practice of imaging, practice of medicine will be going from the routine to the precision medicine. And the precision medicine, the part of imaging is also will become a precision imaging. Next, please. Next, please. A genome evaluation. Genome is something like that is also important. Now, intracellular target. So normal tissue and diseased tissue. So that diagram itself will show a very clear. So that is where the role of nanoparticles in diseased tissue will be there, because there will be easy passage of the particles within the cell. So this can be used for the drug delivery or tagging or identification, diagnosis for different applications. Next, please. Biosensors is sensors. Like we know that there are so many sensors in electrical sensors or something like that. Biosensors is something new entity by using our own body components. Like you have antibodies, you have nucleic acids, antigens. So what is their role actually? The role of gold nanoparticles is used in this nano platform for detection of different viruses. So these sensors act to identify the different viruses, different bacteria or different disease-causing entities by using different mechanisms, like you have dual function photothermal biosensors or transistor-based biosensors or graphene sheet sensors. So these names are something like a very complicated names, but the future coming down the line, maybe in 2 decades or something, this is going to be practically possible. Next, please. So nano diamonds, they are also a part of that, used in inflammation. Next, please. So nanomechanics is something like MRI. Again, the use of nano robots and all that is there. I will talk about nano robots in coming slides very shortly. Next, please. So that is, we have already seen about this. Next, please. Yeah, this is something like we talk about multimodality imaging. So only just I want to stress is ultrasound combined with the different modalities. So you've seen for the RNA delivery. So we have seen about the genetic delivery, genetic imaging. So same thing applies by use of ultrasound. And again, ultrasound can be used as an irradiation. So irradiation is also there, an important entity. Next, please. So now coming to nano robots. So we have talked about robot. We know robotics. There are a lot of, they are big in size, but still, surprisingly, the size of robots in nano robots is compatible with what the nano particle size is. So these nano robots are also going to change a lot in coming days by functioning at various antibodies compatible with the cells. They can interact with the cells. They can sense the different types of cells, whether they are abnormal or normal, by releasing the signal. And again, for the reconstructive and curative mechanisms of the body for various diseases, chronic diseases like diabetes, hepatitis, and neoplasms, and also for the drug delivery. So DNA nanorobot. So nanorobot using the DNA technology for the DNA materials. So this is also an important entity. So they can use in different ways. So a lot of research is coming, a lot of things are coming in future. Next, please. So this nanorobot, what is the role of nanorobot? For drug delivery, for nanoparticle transition, for DNA nanorobotics, management of tumors, immunoresponse or immunotherapy, then MR-based nanorobotics. Next, please. So nanorobotics in gene therapy. So this is like some sort of, you have biochip, you have bacteria-based composition of nanorobots, positional nanoassembly, and new robots. So this is something very multifaceted entity which can be used by nanorobots. And one of this is gene therapy, especially related with the DNA and RNA, or something related with the genetic diseases management, chromosomal replacement therapy, and rectification and repair of genetic maintenance. So these are varied things which are coming. And ultimately, there are a lot of large databases which are required for the nano computer, because the images, the amount of data of the DNA and RNA will not be very small. So for this, along with the nano robots, you need to have a nano computers also. Next, please. So nanoparticles, this we have already seen, but this is pertaining to the nano robots. Next, please. Now coming to the most important entity now, because we are talking about nanoparticles, nanoimaging, nanotechnology, but we are using for human imaging. So does it cause any toxicity? Yes, definitely. There are, but what are the things you need to do it? So they are capable of changing the toxicity levels in a cell. Integrity of membrane can be disturbed. Disruption of the lysosomal membranes can be done, or cells. They can cause release of protons, ions, enzymes, causing different reactions. And major mechanism can be release of polycations, which can cause changes in the cell. So this toxicity has to be dealt with. This toxicity has to be kept in mind. This will result in molecular and cellular defects and damage. So that is where the carbon nanotubes, for example, in lung, can be causing lung inflammation. Rather than using, it can cause inflammation. So these are certain things. Hepatotoxicity because of accumulation of liver enzymes in the blood, because of nanoparticle reaction. Cytotoxicity can happen, which can change the immune system. Injury to spleen, injury to liver, and also macrophages can engulf nanoparticles when they can be circulated. So many things can happen. Endocytosis is like a phagocytosis, pinocytosis, endocytosis. So these are all different things which can be possible with the nanoparticles, and they are part and parcel of the toxicity of the nanoparticles. And this has to be prevented. So now, last, potential nanorobots hazards has a very important potential toxicity. Various immunological and cytotoxic responses can be done, leading to the formation of thrombi, blood coagulation, or damage to skin, or leading to skin cancers. So there are a lot of stuff related. Next, please. So now immunosafety design has to be done. Nanoinformatics for this different toxicity has to be well propagated to prevent this sort of thing. So a lot of discovery, development, and application of these nanoparticles has to be done with a better molecular dynamics and dense functional therapy, which can be more nanobio interactions. So this will have an impact in coming days. Next, please. Now there are again guidelines also. There are safety issues which are not in proper place. So all this has to be come in place and to prevent any toxicity. Next, please. So now before ending, I just want, this is a book which I have written, Advances in Imaging, and I have 2 chapters in that, Nanoimaging 1 and Nanoimaging 2. So all the in-depth details of this nano imaging has been covered in this book, which is written by me. That is a step towards precision medicine, advances in imaging. So next. So this is just an image again, just to recap the sizes. This is a blood circulation, a lot of things can happen. Next. And this is something related with nanobubbles, already I have shown. Next, please. So microbubble reactions, next, please. Yeah, this already I have shown the shapes. Next, please. Now, last slide. So if you see the blend of imaging, these are all nanoparticles. You have optical imaging, PET imaging, ultrasound, SPECT, CT, MR. So most of the imaging modalities are there. In between, PET is related with the radioisotopes, SPECT, radioisotopes, CT, iodine and gold. MR, they have gadolinium and mostly related with the iron perfluorocarbons. And there are so many things. So now the nano imaging will be a bigger, wider, larger entity for amalgamation of this multidisciplinary, multimodality imaging and using the different resources in different patterns for the diagnosis as well as therapeutics. So ultimately, the future of our imaging will be molecular imaging, nano imaging, which will be the concept of the precision medicine, where the therapeutic as well as diagnostic options will be available at the earliest diagnosis of a disease entity and also managing that disease entity as early as possible, reducing morbidity and leading to the progress of a disease in a very short time. So next, please. Thank you all for your kind attention.
Thank you very much, Dr. Shaikh. This was indeed a very detailed and comprehensive talk on nanoparticles and also on nanoimaging and various aspects of nanoimaging. So now I'll open the floor for questions. And I'm checking the chat box if there are any questions posted. So nothing. Sorry.
Yeah, my again internet is fluctuating, so I'll not open my video.
Okay. I think Dr. Maitri Shankar has raised her hand. Yes, go ahead, Dr. Maitri.
Yeah, thank you, Doctor. Extremely informative, almost futuristic talk. We are hearing a lot of, upcoming data and research on systems biology. and a lot of functional medicine type of diagnostics in terms of the hormonal assays or nutritional assays. What is your opinion on that? Or I was very curious because that also sounds quite futuristic, and more so in the diagnostic space of laboratory, where they are looking at systems biology, and nanoparticles perhaps is also in a similar way. So I was curious to see if you had any thoughts on that.
Yeah, I think as far as the imaging, the uh, use of the different entities, like you told about the biological aspects of various tissues, the evaluation, the diagnosis has come to a molecular level. So anything you are talking about is being first of all investigated or trying to get it validated by whatever imaging modalities, so that you get a precise information at a very early stage, so that you are going to know what exactly is going to happen. But as for the data is concerned, so as I have told, a lot of stuff is in the preclinical stage or in the research stage. So before using that for proper use for the clinical use, so first of all, it has to be centric data, huge data with a varied demographic coverage, so that to validate this data, the ultimately
Right.
use for the particular day-to-day practice has to be, it will take time. And another thing is, once you have a data, then only the validation, for example, you need an approval by FDA or somebody to use that particular entity, particular nanoparticle for a clinical use. So still, I feel there are a lot of things in infancy actually, because it will take little longer time, because we are talking it very easily, but doing it, getting it, validating it, it will definitely take a longer time. So we need a bigger data. Data is very important in this.
Right. And do you see this as something which will be absorbed into already existing specialities? Or do you see any scope for an individual specialist, like a nanoparticle specialist? I mean, you spoke about how we can use it in CT and MR, and yeah, that will probably be taken up by radiologists and nuclear medicine. But do you see any scope where it isn't come under a particular umbrella and it could stand as a subject of its own?
I think this is debatable issue, because the word, if you I use and I tell it is a molecular imaging. So if you see, the molecular imaging doesn't mean only radiology or nuclear medicine now. It is part and parcel of, you see, the molecular pathology, which is growing at a very faster pace. You have genetic engineering, then you have molecular biology. So you have different entities, different branches which are being there. So only the thing here is, like in future, probably we are landing not only with this nanoparticle or molecular imaging, but mostly the stuff is wider, bigger. So it is not possible. Probably I can claim as a radiologist, or somebody can claim as a nuclear medicine, that nanoimaging is a part and purview of that, and we are going to be like under us, like you have a PET CT under nuclear medicine, or you have MR under radiology. So probably I don't think this is going to happen, because this is multifaceted, multidisciplinary entity. Even engineering guys, a lot of engineering work is there in that. You can't claim. So it is like, still I feel like it is debatable. But my view, my personal perception in future is like, it becomes, it will be little difficult for to claim somebody that this is my entity or this is my branch. No, I don't think so. It will take longer time, because multidisciplinary. You have biology, you have engineering, you have pathology, you have nuclear, you have physics, you have chemistry. So many things. You have nuclear.
Right. Yeah, thank you.
Do we have any more questions?
Thank you, Dr. Shaikh. I just had a quick question. Where do you think this is headed from a routine clinical perspective application? You know, a lot of stuff is exciting, but there are practical and logistical issues that hamper.
Yeah.
I mean, I used to work on microbubbles in 1999, 25 years ago. And although they are FDA approved for some purposes, the promise of targeted imaging with microbubbles has never been realized. And same with gold nanoparticles. We've been doing MR with gold nanoparticles for more than 2 decades. And so realistically, where do you think this will become a routine clinical application? I mean, granted, things are different in you know, US and Europe or India from you know, payment and reimbursement perspective, but from a purely patient perspective, when do you think this can become more of a reality than an exotic topic for discussion?
I think practically it's a very good question, a very valid question. And the way you had told, like microbubbles or ultrasound contrast, probably it was 25, 30 years back when there are a lot of research happening. And today, even in India, if you see the major institutes, we are not using ultrasound contrast agents like microbubbles and all that. So practically there are a lot of hassles in that. It's not like that, even though if it is FDA approved or in India, it is approved for using in a clinically, but still there are a lot of factors. The use, the people awareness is less, and the application, the costing is one of the biggest hurdle which will come probably, because these are all the stuff which is looks fascinating, which looks like tailor-made precision medicine, precision imaging. So probably we can just, okay, you are getting something symptoms, we'll diagnose and treat it there and there itself. But probably financially they were going to cost you a bigger amount. So I don't think immediately this is going to happen, because it is very good for me or somebody to being in research to discuss about this, but practically to come to exactly in a clinical imaging, so it may take a very long time, as we have taken for microbubbles probably 25, 30 years. So hopefully, but it has to be multicentric. A lot of people should be involved. The interest groups has to be more mobilized and try to do more and more stuff, and so that better approval, better demographic involvement, better studies, multicentric studies with a bigger volume, then only the results will come, and probably this will. And again, the part and parcel is like we are the guys who are doing, but again, somebody is creating, because again, it is an amalgamation. You need an engineers to design it. You need a biologist to understand it. You need a pathologist to find it. So these are all we have to work together. It is not like one man entity, so show will go on. So amalgamation of all the disciplines at one point, working together for a length of a time. It doesn't happen. It is not going to happen in 1 month or 1 year, probably 3 years. This I'm doing it, but hopefully it will happen, and definitely probably down the line, delayed or something, but it is going to happen. The concept of precision medicine is going to come for sure.
Thank you.
Thank you, Dr. Shaikh. If there are no more questions, then we will conclude the session. Thank you all for your attendance and participation. We look forward to seeing you again next month, same time, on Saturday evening for India and Saturday morning for US. Thank you.
Thank you.
Thank you. Wonderful
Thank you,
session.
Jyotsna ma'am. Yeah, thank you all.